Federal Drive is presented by GEHA, Government Employees Health Association, proudly providing health and dental benefits to federal employees and their families. Visit GEHA.com.
The Trump administration nominated and Congress approved at least one experienced hand to the Veterans Affairs Department. Paul Lawrence became Deputy Secretary last month. During the first Trump administration, he ran the Veterans Benefits Administration, and now he's got to find new health and benefits executives. For an update on this and other matters, Paul Lawrence joins me now. Dr. Lawrence, good to have you with us.
Hey, great to be back with you, Tom. Thank you.
And let's begin with just an issue that kind of has been lingering for some time for VA that's not really connected to any party or any nomination, and that is the budget shortfalls produced mainly by the PACT Act and some heavy hiring that went on. What is the status now, or did Congress come up with the supplemental funds and you're okay there?
Well, you remember last fall, the previous administration had a real hard time accounting for money, right? A shortfall, then there was an overage, then whatever. But we finally got our hands on that. We have experienced folks here who understand finance and the importance of a financial system and the importance, quite frankly, of being good stewards. So we're talking where the budget is just coming out, and we expect, Congress to really come forward and support veterans because they, in fact, trust what we're doing, that we have a good handle on it. So I would say, yes, things are better, and we expect we'll be able to work within the budget they give us.
And what is the staffing situation? Because it seems like a lot of numbers have happened, 80,000 fewer people, and there was a hiring overhang, I think, for the PACT Act at some point in the last 18 months or so. So what is the staffing level? Are you done hiring and firing and adjusting, and what's going on there?
The previous team really liked to hire people, but I'm not so certain they ever figured out what they were going to do. So we've come in and noticed that there's a lot of hiring gone on, but service to our veterans really hasn't gotten better. Wait times to make appointments are longer. The challenge of getting benefits is longer. So what we really want to do is consistent with the broad approach across all of government, which is to reduce staff by 15%, be in line with that, and really focus on making sure that we're delivering good services. More than 300,000 positions are exempt, and those are the positions that provide health care and benefits. But we're really trying to figure out, can we do with less bureaucracy? Can we do with less people doing PowerPoints? Can we do with less designers and things like that, so we can really up our game in terms of service to veterans? So again, we'll be rolling out a plan later this spring where we will have some targeted reductions. 80,000 is a goal, but a lot of it's to be figured out by our folks who are closest to serving veterans, and we want to make sure we understand what they need to do that really well.
And can, for example, the medical center directors, the high-level executives that are career, are they enlisted in that effort to say, well, here's what I could do without, or here's what's not contributing?
Oh, absolutely. They're key because, of course, we want to make sure that somebody really close to providing the services knows exactly who's needed, exactly the way you're describing. Their input is key because they're there serving veterans.
And nurses, therefore, and doctors and so forth. I mean, a lot of those 300,000, I imagine, are Title 38 people that really provide care.
Exactly, providing care, but also don't forget, we have people that provide benefits, right? They're claims adjudicators. We have people that perform memorial services. We know that's important, right? And so exactly right, trying to figure out the right balance because, of course, this will result in savings, and we want to drive those savings to provide care. We need more community care. It's expensive. That's where some of the money will go.
Right, and community care, is a controversial issue, I guess, for some. But is the long-term plan to maybe even increase community care for those routine matters that don't necessarily require a VA medical center for expertise in highly specialized areas if someone has a toothache?
Well, it really disappoints me, Tom, that this is a controversial issue because the law that came out in 2018 was pretty clear. It's mostly around access. Does it take too long to get to our facilities? And out west where most of the country lives, but we forget about in Washington, right? It's long drives to get there, as well as the specialties if you can't get to certain people in certain time. So I think, the way our country is in the geography, it'll play its way out naturally. I don't know that there's any I know of no design to do what you're describing. I just think we want to be focused on getting veterans the care that's convenient for them and appropriate for their situation.
And there's an information technology underpinning to one of the things that you mentioned early, and that is appointment wait times. And a lot of times that's algorithmic, and there are systems to support that. And that was an issue a few years ago, that the antiquated systems for appointments and so forth. Are you looking at that front, the whole IT part, that can really help drive some of these improvements?
Oh, absolutely. We have a big push on bringing technology to bear to the problems, right? What technology can we use to process claims? What technology can we use to get appointments? But one thing I'll say, though, we very much know we are in a people business. People make the decisions if you get benefits. People make the decision about your care. We're not naive to think that one day everything will be done by bots and whatever. So we really understand the technology should support us, and we need really good technology to do that.
But in the basis of just making something ordinary, like an appointment, it seems like there's a lot of algorithmic help that could help there just to get people in the door. And then obviously you don't want a bot examining them.
No, absolutely. And, our veterans are smart and clever. They see what's going on in the private sector. It's appropriate they ask us, how comes you don't have this cool stuff like what you're describing? No, we feel that pressure.
We are speaking with Dr. Paul Lawrence. He's Deputy Secretary of Veterans Affairs. And during the first Trump administration, in part driven by pandemic, but also by the way medicine is changing, there was a pretty big increase in telemedicine. And that took technology, and it also took technique, because conducting a telemedicine exam is a specialized kind of art. What's going on there, and is that still something under expansion?
Yes, it's gotten better. Technology's gotten better. Apps that allow you to do and see things have gotten better. So yes, that's still an option we provide to veterans. It is popular in part because of what they learned in the pandemic. But again, the Secretary is very clear. Veterans should have choices. That means they should have choices in how they want to do this, right? If telemedicine works for you, great. If you'd rather have in-person visits, we want to do that too.
And that leads to the electronic health record, which ties the community care together and all the care together. Let's say that has been a challenge, to put it politely, for VA and VHA. What's the status now? I guess there's one new center that's about to get the new Cerner system.
That's right. Well, we're upfront about it. It has been a challenge. The history is pretty clear. I felt the frustration during confirmation when I talked to senators, as well as when they asked me about it, right? Secretary was very clear. Prior to me getting confirmed, he gathered the best minds. There's a new schedule that accelerates how we're going to implement it. There's new thinking about it, learning from some of the struggles from before, as you point out. More standardization, more rollout. That's our plan. We really think it's key. And, funny, Tom, only in Washington does talking about a technology project get people excited. We want to shift the dialogue and talk about the great benefits this will bring to our veterans, right? A record that has all the information that doctors can quickly access so they can get you the right care and the right solutions. We want to be talking about healthy veterans real soon, not so much the EHRM. But, yes, that's on our radar, and it's something I personally think about every day, because I found out when I got here, the Deputy Secretary is actually accountable for this project. So yes, this is something I'm very seriously focused on.
And one of the issues I've noticed about this is that there seems to be someone in leadership for the EHR project that changes every 6 months. There's been person after person, with a little continuity in the application of that program so that someone could make it their life's work. Only you've got 2 years or something.
Yeah, well, it's my life's work, and we have an acting executive director, and it's his life's work, and has a pretty serious team. We also are very fortunate. We have very serious partners at Oracle Health and a couple other companies that work with us. So they all know the importance, and they all feel the pressure, quite frankly. It's not very satisfying to be known that you're working on a struggling project. It's not very satisfying to hear veterans complain. We know it has to be better. The Secretary knows it has to be better. He's holding us accountable, and veterans are holding us accountable, veterans and their families, and they should, and we understand that.
We're speaking with Dr. Paul Lawrence. He's Deputy Secretary of Veterans Affairs. I guess that pretty much wraps up the technology challenges. Anything else on that front that you see VA facing?
Well, I'd be remiss if I didn't talk about what GAO reminds us about constantly, which is less about the technology and more about the change management. So we know that's something we have to focus in on, right? The great new thing about technology is it brings new things that our medical providers need to do to take advantage of that. So we know that's something that needs to be improved. So we're thinking hard about that. We want them to embrace this and say, this is an awesome new tool that really helps us. So we're trying to work through that as well.
And in the area of change management, VA will soon have a new undersecretary for benefits and one for health, and that's your job is to find those individuals. What is the process for getting undersecretary?